everybody, welcome back. Today we're going to look at alginates and mixing up models in the lab. We use things like alginate, which is a yellow sticky substance that goes onto the teeth to make a model of the teeth. Sometimes we use it for a crown preparation or orthodontic work or study models. So we're going to have a bit of a closer look today, look at methods of how to mix alginate and how to pour up models in the lab. So let's get underway. So here I have some alginate or orthoprin in this little bag. So this is what we use to make initial impression. So you just mix this guy up with a little bit of water. It's vanilla scented, small like vanilla cupcakes, but there is a method. So you need to make sure that it's the right consistency. Too sloppy and it's going to go everywhere, all over the patient, and too thick, it's going to set too quickly. So we use these little guys here. These are impression trays. They're sterilized, they go through the autoclave, and you mix this one up and place it into the trays. There's an upper and a lower. This one here is the upper, and this guy here is the lower. So you can see that that part's open, and the upper has a top enclosed part for the palate. So let's have a bit of a gander as to how to mix an alginate impression. So in front of us here, I have what we need out to mix our alginate. So this is the alginate here, and it comes with a little scoop like this. Yours might be a bit different depending on the brand. Sometimes they're different colors. Sometimes even the alginate, you can mix it and when it gets close to setting, it changes color. So when mixing the alginate, it depends on the patient again. General rule of thumb is 2 scoops for a mix, but depending if you've got a patient that needs a bigger tray or maybe a child for mouth guard, you might only use 1 or sometimes as much as 3 scoops. I've never mixed 4, but I know that there is a mix for that. So 2 scoops. Have your alginate trays out and ready. You'll move over to the sink to get this made up. Grab your paddle, grab your bowl, and let's head over. And that is a alginate taken off it's very fresh, taken off my teeth. So let's clean it up, get it sterilized, and we can go have a look in the lab on what to do next. So now we're getting ready to pour up our little alginate with the stone. So please make sure when you're working with stone that you wear a mask, glasses, and your gloves. It is plaster, so you don't want to be breathing that stuff in. A fine powder can sometimes come up when you're mixing, so let's make sure we're ready for that. So mixing stone, this is our dental stone here. You just scoop some up into a bowl. Again, the same principle applies with alginate and stone. Don't make it too sloppy, otherwise it's going to go everywhere. You kind of want it the right consistency, but let's be honest, the more you do it, the better you're going to get. So the more trial and error, the better it's going to be for yourself. Give yourself time to learn this. It's something that even I struggle with to this day with making models. So let's have a bit of a look on how to mix. So there's a few different stages to our mixing process with stone. So you mix it up and then you take it into your lab and you vibrate all the bubbles out using the vibration machine. Then you pour it into your alginate mold. So let's have a little bit of a look at how I go, and I hope I do it right.
now that our model has cured and set, it does take a little while, so leave it for about an hour. This is a finished product. This is a pretty munted looking model, if I do say so myself. Turns out it's actually pretty hard to take an alginator yourself, but this is what happens when the stone's all set and cured. I have braces on too, so it's kind of compromised the impression a little bit, but you can see it's got all the teeth, the braces. Now, see how this is all lumpy bumpy and kind of yucky on top? This actually goes into a grinder when you're finished, and you polish it up and make it all nice and smooth. But yeah, just due to infection control, I can't actually bring this guy into that part of the practice. So you're just gonna have to take my word on it. But all that's involved is, it's like a big disc that goes around really fast, so you do need to be very careful, and you just gently apply pressure and the wheel reduces the excess of your model. But yeah, that was alginate and model pouring. With your alginate that came off this guy, you just discard that, and the tray goes into steri, and you sterilize that for future use. But that was our video. I hope that was helpful. I hope you enjoyed it and you found it entertaining. Okay guys, have a great rest of your day. Stay safe, happy nursing, happy assisting, and I will see you next time. Have a good day.